Back pain is something that almost everyone experiences at some point in their life. It can be mild and annoying or severe and debilitating. It affects people of all ages, from young adults to the elderly. In fact, back pain is one of the leading causes of disability worldwide, affecting work performance, daily activities, and quality of life. Despite being so common, many people don't fully understand the reasons behind back pain, what it actually means, how to manage it, and most importantly, how to prevent it from recurring. In today's video, we are going to explore the world of back pain in depth. So, if you or someone you know is dealing with back pain, make sure to watch this video till the end. Back pain usually originates from the muscles, ligaments, nerves, bones, or discs of the spine. The pain may be localized in the lower back, mid-back, or upper back, or it may radiate down to the legs, especially in cases where nerves are involved. Sometimes, the pain develops gradually due to poor posture or a sedentary lifestyle. Other times, it can happen suddenly after lifting something heavy or making a wrong movement. Some people feel sharp, shooting pain while others experience a dull ache that refuses to go away. In more chronic cases, back pain can persist for weeks, months, or even years. But what actually causes it? There are many causes of back pain, ranging from physical injuries to underlying health conditions. The most common cause is muscle strain. This usually happens when the muscles or ligaments in the back are overstretched or torn. It can result from lifting heavy objects improperly, twisting awkwardly, or sudden movements. People who work in jobs that involve bending, lifting, or sitting for long periods are particularly vulnerable. Poor posture is another major contributor to back pain. Sitting hunched over a desk or slouching on a couch puts constant stress on the spine, which over time can lead to pain and discomfort. Herniated or slipped discs are another cause of back pain. Our spine is made up of vertebrae with soft discs in between that act as cushions. When one of these discs slips out of place or becomes damaged, it can press on a nerve, causing intense pain, numbness, or tingling, often radiating to the legs. This is commonly known as sciatica. Other structural problems, such as spinal stenosis, which is the narrowing of the spinal canal, can also cause pressure on nerves, leading to chronic pain. Conditions like arthritis, osteoporosis, scoliosis, and even kidney infections can also cause back pain, though these are less common. Psychological factors also play a role in back pain. Stress, anxiety, and depression can amplify the perception of pain and make symptoms worse. People under constant emotional stress often hold tension in their muscles, especially in the back and shoulders. This muscle tightness can lead to or worsen back pain. In some cases, pain continues even after the original injury has healed, due to the nervous system becoming sensitized. This is known as chronic pain syndrome, and managing it requires a holistic approach that addresses both the physical and psychological aspects. Lifestyle choices can significantly affect your back health. A sedentary lifestyle weakens the muscles that support the spine, making you more prone to injuries and discomfort. On the other hand, regular physical activity, especially exercises that strengthen the core, can provide support to your spine and prevent future problems. Obesity is another risk factor. Carrying excess weight puts additional stress on the spine, especially the lower back. Smoking also increases the risk of back pain because it reduces blood flow to the discs in the spine, making them more susceptible to degeneration. One of the key ways to manage back pain is through self-care. Rest can help in the initial stages, especially if the pain is due to muscle strain. However, too much rest can actually be harmful. Prolonged inactivity leads to muscle stiffness and weakness, which may worsen the pain. It's important to stay as active as possible and return to normal activities gradually. Applying heat or cold packs can provide relief. Heat relaxes tense muscles and improves blood flow, while cold can numb the pain and reduce inflammation. Over-the-counter painkillers, like ibuprofen or acetaminophen, can be helpful for short-term relief, but they should not be relied on long-term. Physical therapy is often recommended for back pain, especially if the pain is persistent or recurring. A physiotherapist can design a personalized exercise program that strengthens the muscles supporting the spine, improves flexibility, and corrects posture. These exercises not only help relieve pain but also reduce the risk of future problems. Manual therapy, such as massage or spinal manipulation, may also be beneficial in some cases. Yoga and stretching can be effective too, especially for chronic lower back pain. Yoga focuses on gentle movements, breathing, and relaxation, all of which help reduce muscle tension and improve overall well-being. Sometimes, medical intervention is required, especially if the pain is severe, doesn't improve with self-care, or is caused by an underlying condition. In such cases, imaging tests like X-rays, MRIs, or CT scans may be needed to identify the root cause. Based on the diagnosis, treatments like prescription medications, steroid injections, or in rare cases, surgery may be considered. It's important to consult a doctor if you experience symptoms like numbness, weakness, fever, or loss of bladder or bowel control along with back pain. These could be signs of a more serious condition that requires immediate attention. Prevention is always better than cure, and when it comes to back pain, there are several things you can do to protect your spine. First and foremost, maintain a good posture. Whether you're sitting at a desk, driving, or using your phone, make sure your back is straight, shoulders are relaxed, and your feet are flat on the floor. Use chairs that provide proper back support, and avoid sitting or standing in the same position for too long. If your job involves heavy lifting, learn to lift correctly by bending at the knees and keeping the load close to your body. Avoid twisting your spine while lifting. Exercise regularly to keep your muscles strong and flexible. Focus on exercises that strengthen your core muscles, such as planks, bridges, and abdominal crunches. Low-impact aerobic activities like walking, swimming, or cycling are also great for back health. Stretching should be a part of your daily routine, especially if you spend long hours sitting. Staying at a healthy weight reduces the stress on your spine, and eating a balanced diet with enough calcium and vitamin D helps keep your bones strong. If you smoke, consider quitting, not just for your lungs, but also for your back. Sleep position also matters. Sleeping on your back with a pillow under your knees or on your side with a pillow between your legs can help maintain the natural curve of your spine. Make sure your mattress provides adequate support and isn't too soft or too hard. Using the right pillow can also make a difference. Avoid sleeping on your stomach, as it can strain your neck and back. If you find yourself waking up with back pain, your sleeping posture or mattress might need an upgrade. Let's talk a bit more about chronic back pain. When pain lasts for more than 3 months, it's considered chronic. This kind of pain often doesn't respond well to traditional treatments like medications or rest. Instead, it requires a more comprehensive approach. Cognitive behavioral therapy (CBT) can be helpful for managing chronic pain. It teaches techniques to change negative thoughts and behaviors associated with pain. Mindfulness and relaxation techniques can also help you cope better. Pain management specialists often work with patients to develop long-term strategies, including a combination of physical therapy, psychological support, and lifestyle changes. Alternative treatments like acupuncture, chiropractic care, and herbal remedies are popular among some people for back pain. Acupuncture involves inserting fine needles into specific points on the body and may help stimulate healing and reduce pain. Chiropractic care focuses on spinal adjustments to improve alignment and relieve pressure. However, it's important to consult qualified professionals and discuss any alternative treatments with your doctor, especially if you have other health conditions. Back pain doesn't just affect your body, it impacts your mood, sleep, productivity, and relationships. It's frustrating when simple movements like bending or walking become painful. It's normal to feel stressed or anxious about it. That's why emotional support is important. Talk to family, friends, or support groups if the pain is affecting your mental well-being. You're not alone, and there are many resources and therapies available to help you cope. In conclusion, back pain is a common but complex issue. It can arise from various causes, including poor posture, injury, underlying health conditions, and lifestyle habits. While it can be painful and disruptive, there are many ways to manage and prevent it. From self-care, exercise, and physical therapy to medical treatments and mental health support, a holistic approach works best. Pay attention to your posture, stay active, manage stress, and take care of your overall health. If your pain persists, don't ignore it, seek professional advice. Back pain may be a part of life, but it doesn't have to control your life. With the right knowledge and actions, you can take charge of your spine health and live a more comfortable, active, and pain-free life. If you found this video helpful, don't forget to like, comment, and subscribe to our channel for more informative content about your health and wellness. Stay healthy, stay strong, and take care of your back. Thank you for watching.